Good afternoon. Would like to call this December meeting of the McLean County Board's Health Committee meeting to order. Beginning with the roll call, we have members present except for Member Farley, and Member Tompkins has requested to call in. Having conducted the opening roll call and declared a quorum is physically present, I would like to inform the committee that Member Tompkins is requested to participate remotely under County Board Rule 2020 and in accordance with the Open Meetings Act. Notice was received from Member Tompkins and in accordance with rules per Board Rule 2020. Member Tompkins will be authorized to attend the meeting electronically if a motion to approve the member's electronic attendance is made, seconded, and adopted by the majority members of the committee. May I have a motion to approve Member Tompkins' remote attendance? Motion by Bell, second by Hanson. Those in favor? Aye. Those opposed? The motion is passed, and the record will show that Member Tompkins is present for the meeting. Jeff, can you hear us okay?
Yes, sir.
All right, moving on. Do we have any appearances by members of the public or county employees today?
Chair Byrne, we do have one request to speak, and that is Jeffrey Mraz.
Excellent. Welcome, Mr. Rouse. You may step right up to the podium.
Correct. He
Mr.
is
Mraz?
representing an organization, so he will have 5 minutes.
All
All right, cool.
Whenever you're ready, sir.
I'll just pick it up. It's a little easier. I'm one of the owners of Keg Grove Brewing Company, and I just kind of wanted to stop by and take a couple minutes of your time just for clarity and understanding. A lot has happened over the past month, I'd say, regarding hemp drive THC beverages. Many local businesses were affected by choices that were made. Inconsistent ones. And obviously there's a lot of, I'd say, a lack of understanding at federal, state, and local levels. There's a lot of gray area there. And it's, everything, we're small businesses, government relies on us, we pay taxes, we all benefit. It's kind of a crushing blow, and without direction or warning, somebody comes in and says you have to dump and discard all of your products. And I guess that's it. We're just looking for more understanding and guidance in this. I don't want to get into specifics. We were not one of the places that were asked to get rid of any products. However, many of our customers and clients were. So just kind of want to take a chance to share. Anybody have any questions on that? Cool. Thanks.
Thank you very much, Mr. Rouse. Appreciate hearing from you. Moving on to the consent agenda, we have the approval of minutes from November 4th, 2025 regular meeting, and the recommended approval of bills and transfers, if any, to the county board totaling $569,041.52. May I have a motion? Motion by Hanson. May I have a second? Second by Bell. Those in favor?
Aye.
Those opposed? And that motion passes. Moving on to item number 4, departmental matters, starting with Mr. Wiley from the nursing home. We have 4 items for action today. Item number 4A1A, request approval of service agreement with Elevate Therapy Group, LLC. May I have a motion? Motion by Hanson, second by Mr. Bangert. Mr. Wiley, anything to add?
Hello, everybody. This agreement expands the services that Elevate will be providing for us. They've already been doing a great job with consulting. We've had an opening in the MDS coordinator position actually since July. It's a very hard position to fill, but it's a very critical position, not only for the nursing operation, but also for reimbursement for revenue. So their consultants have been doing the MDS work for us, and we've been paying the consultant rate for that. This agreement actually allows us to have an interim MDS coordinator from them that will work off-site at a more affordable rate, and this MDS coordinator will be under their supervision. So the consultants will be supervising this individual, and it will be at a more affordable rate for us.
Gotcha. Any questions from the committee?
Yes,
My
Mr.
question.
Chairman,
So-
if I may.
Oh, sorry. Go ahead, Member Tompkins.
Yes, sir. Mr. Wiley, will this Elevate consultant, will they be based in the United States?
Yes, they are.
Thank you, sir.
And then follow-up question to that. Sorry, Member Tompkins, do you have anything else?
No, sir, that's all. Thank you.
All right, thank you. Will this individual, this sounds like a third-party employee. They're not employed by the county then, are we? Is that correct?
That is correct.
Okay, and so the position that we've been trying to hire since July, is that for an internal posting or is this a similar third-party posting that we've been looking for?
We will continue the search for a full-time McLean County employed MDS coordinator.
Gotcha. Okay. All right, thank you very much. Any other questions? Those in favor of 4A1A signify by saying aye.
Aye.
Aye. Those opposed? Motion passes. Moving on to 4A1B, request approval of a proposal from Wilscott Solutions Center for a temporary office space. May I have a motion? Motion by Hanson. May I have a second? Second by Bell. Mr. Wiley.
This is related to the construction project for Phase 3. We will lose use of 17 different office spaces, so we'll be moving people around. We also need the temporary restroom space, so this is an office trailer and a restroom trailer that will be necessary during Phase 3.
Gotcha. Questions from members of the committee? Those in favor?
Aye.
Those opposed? Motion passes. Moving on to item 4A1C, request approval of proposal from Rolling Restrooms.
So rolling restrooms
sorry.
actually was in, I'm
Please continue.
sorry.
Yeah, well, let's get a motion on the floor. May I have a motion, please? Motion by Hanson, second by Bell. Mr. Wiley.
My apologies to Mr. Roberts and his rules of order. Actually, rolling restrooms was included in the same memo that Will Scott was. So rolling restrooms would be the vendor providing the restroom trailer.
Gotcha. Okay. Any questions from members of the committee? Seeing as there are none, those in favor, say aye.
Aye.
Those opposed? Motion passes. Moving on to item 4A1D, request approval of an intergovernmental agreement between the County of McLean and the City of Bloomington for the temporary use of kitchen facilities. May I have a motion? Motion by Hanson, second by Bangert. Mr. Wiley.
And this agreement allows us to use the kitchen facilities at the arena while our kitchen is out of commission for Phase 3 of the construction project.
Excellent. Any questions, members of the committee? Member Hanson?
Less so a question and just a note of gratitude to the city of Bloomington for them being able to provide this. Very, very grateful.
Indeed. We will send them an official high five. Any other questions? Those in favor of item 4A1D, please signify by saying aye.
Aye.
Those opposed? Motion passes. Any other items to add for informational purposes, Director Wiley?
No, I'm sure that you had a chance to look over the report, and I'm happy to answer any questions that you might have.
Okay, thank you. Any further questions, members of the committee? Thank you as always, Mr. Wiley. Moving, excuse me. Moving on to item 4B, Diane Hughes, Jail Superintendent, Lancaster. Advanced Correctional Health Care. We have one item for action today. Item 4B1A, request approval of an Illinois Medication-Assisted Recovery Learning Collaborative Memorandum of Understanding Continuation Grant. May I have a motion, please? Motion by Member Hanson, second by Member Bangert. Ms. Hughes.
Good afternoon. The grant will be for $15,000 to assist with the purchase of medication for the individuals incarcerated in the adult facility. Currently, we have 28 individuals on our medication program. We do have a recovery pod, which is now full. So we are waiting. We have some people waiting to get in that pod, but it's been growing and going very well with the new collaborative psych provider from Carl.
Okay. Questions from members of the committee? Just to clarify, you said the recovery pod is full. This is, I'm assuming, a specific wing for those in
Yes.
recovery? How often does it get full like that?
It's just recently, but we're waiting for some movements in the housing when we have one housing unit that is being worked on. So once that's done, we can restructure, and more people will be able to move into that.
Okay, all right, sounds like a worthwhile grant then, for sure. Any other further questions? Those in favor of item 4B1A, please signify by saying aye.
Aye.
Those opposed? Motion passes. Ms. Hughes, anything else to add?
No.
All right, thank you so very much. Moving on to item 4C, Jason Tabb, Juvenile Detention Superintendent. We have one item for action today, item 4C1A, request approval of a contract with Kathy Vogel for counseling services with the McLean County JDC. And do I have a motion? Motion by Hanson. Do I have a second? Second by Member Bangert. Mr. Tabb.
Good afternoon. This is just a renewal of the contract that's been in place for a number of years for our therapist.
Okay, thank you. Any questions from members of the committee? And since there are none, please, let's take a vote. Those in favor, please signify by saying aye.
Aye.
Aye. Those opposed? Thank you. Item 4C1A passes. Mr. Tabb, anything else to add?
No, nothing to add.
All right, thank you very much. Moving on to item 4D, Jessica McKnight, Director of the Health Department. We have several items for action tonight, starting with 4D1A, request approval of an ordinance to amend Chapter 205 fees, Article 11 miscellaneous code fees in the McLean County Code for Chapter 216 food service. And may I have a motion? Motion by Bell, when she got to there. May I have a second? Second by Hanson. Director McKnight.
So as noted in my memo, we are seeking to update our fees for food service permits, and our fees are within the county code, so we're bringing this forward, has been reviewed and approved by the Board of Health, and also was included in our approved 2026 budget for these rates.
Okay. Any questions from members of the committee? Seeing as there are none, those in favor of item 4D1A, request approval of an ordinance to amend Chapter 205 fees, Article 11 miscellaneous code fees in the McLean County Code for Chapter 216 food service, please say aye.
Aye.
Those opposed? Item passes. Moving on to item 4D1B. Request approval of an ordinance to amend Chapter 205 fees, Article 11 miscellaneous code fees in McLean County for Chapter 310 sewage disposal systems, water wells, and geothermal exchange systems. May I have a motion? Motion by Bell, second by Hanson. Director McKnight.
So similarly, our permit fees for the sewage, wells, and geothermal systems are also in the county code, so this is just updating that county code to reflect the change in the fees.
Excellent, thank you. Questions from member of the committee? Seeing as there are none, those in favor of item 4D1B, please say aye.
Aye.
Those opposed? Item 4D1B passes. Moving on to item 4D1C, request approval of an emergency resolution amending CY25 combined appropriation and budget for Fund 0105, 0061, 0067 Preventative Health Program. May I have a motion? Motion by Hanson, second by Bell. Director McKnight.
Yeah, we have received several new grants from Illinois Department of Public Health for their fiscal year 2026, which started in July of 2025. And so we are looking to, in the next couple items, just amend our budget, our original approved budget for 2025 to reflect those grants. And also have the auditor add the appropriate lines so that we can add the revenues and the programs.
Excellent, thank you. Questions from members of the committee? Seeing as there are none, those in favor of item 4D1C, please signify by saying aye.
Aye.
Those opposed? And the item passes. Moving on to item 4D1D, request approval of an emergency resolution amending CY25 combined appropriation and budget for Fund 0107, 0061, 0061 West Nile virus. May I have a motion? Motion by Hanson, second by Bell. Director McKnight.
This is the tick surveillance grant. So again, one of the new grants from Illinois Department of Public Health, and just for us to be able to add it into the 2025 budget for the health department.
Excellent, thank you. A necessary service for sure. Questions from members of the committee? Seeing as there are none, those in favor of item 4D1D, please signify by saying aye.
Aye.
Those opposed? Motion passes. Moving on to item 4D1E, request approval of an emergency resolution amending CY25 combined appropriation and budget for Fund 01120061 0060 behavioral health. And may I have a motion? Motion by Hanson, second by Bangert. Director McKnight.
Another grant from Illinois Department of Public Health, part of our local health protection grant, but this will allow us to work further with opioid overdose prevention.
Excellent, thank you. Questions from members of the committee? Seeing as there are none, those in favor of item 4D 1E, please signify by saying aye.
Aye.
Those opposed? Motion passes. Last one, moving on to item 4D1F, request approval of an emergency resolution amending CY25 combined appropriation and budget for Fund 01120061 0111 TB services. And may I have a motion? Motion by Hanson, second by Bangert. Director McKnight.
We've received additional funding from Illinois Department of Public Health that will support our tuberculosis prevention services. So happy to be able to add that to our 2025 budget.
Excellent. Questions from members of the committee? Seeing as there are none, those in favor of item 4D1F, please signify by saying aye.
Aye.
Those opposed? Motion passes. Director McKnight, anything else to add?
You have my report for the month, and it includes the third quarter updates from our program. So happy to answer any questions.
All right, thank you very much. Moving on to item 4E, Cassie Taylor, County Administrator.
Thank you, Chair Byrne. I have nothing to present to this committee this evening. I will note, though, in number 5, other business, we do have a typo that should reflect the January 6th, 2026 meeting.
All right, thanks for the heads up. Thank you, Administrator Taylor. Do want to call out and send congratulations to a fabulous organization in our community, Lifelong Access. Had an opportunity to visit along with Vice Chair Hanson and tour their facility and hear about all the amazing things that they have been doing. This is an organization that is very special to me because somebody that does use accessibility services in my work and daily life, it is so helpful to have such helpful organizations out there like Lifelong Access and support the work that we do. So big congratulations to them on their longevity in the community. And then as well.
Yeah, I wanted to take a moment. Last night, Chair Byrne, as well as Member Bell, and I were able to attend a World AIDS Day event at Bloomington Public Library. Really cool partnership between Prairie Pride Coalition, Central Illinois Friends, as well as our health department. We were able to bring forward pieces from the AIDS quilt that was spread on the Washington DC National Mall. A really, really powerful and impactful piece of art and history. It's important to note that it's been 40 years since the first AIDS-related death in McLean County. I also wanted to just spotlight the amazing work that our health department does for prevention services. And as noted in Director McKnight's report, we had one of our own, Aaron O'Malley, who accepted the Illinois Public Health Association's Program of Excellence Award for our HIV program, Prep for HIV program at the annual association conference, which is just really, really awesome. There was a line last night that somebody said that really stuck with me, which was in regards to how we're very, very close to ending HIV/AIDS, how you don't stop cheering at the end of a marathon, you cheer even harder to make sure that you have the energy and drive to push through. And I am just so thankful for the work that our health department does to keep that fight going and truly end this horrific, horrific disease. So thank you.
Indeed. Thank you, Vice Chair. Just to echo all of that and point out something else that was said, there was a tremendous focus on community last night, and that was called out favorably. This was in the evening, in a snowstorm, and it still drew a lot of people, and that number of people was very, very appreciated by those that were there. So it is great to be part of a community. It is great to be a contributor to that, and proud to do so. So, members of the committee, anything else to add? All right, thank you very much. Our next meeting date will be Tuesday, January 6, 2026, at 4 p.m. in this room, and we are adjourned. Thank you all very much.